Welcome back, everybody. We're going to switch gears for a moment and talk about mental health now. You know, holiday stress has been known to increase the problems of people who suffer from mental illnesses. And add that to the continuing pandemic, high prices at the grocery store, and maybe something personal you have going on. There is help out there, though, if you need it. And here with some advice. And where to seek help is Dr. Rochelle Head-Denham. She is the Executive Director and Medical Director with the Metropolitan Human Services District. Welcome back, Dr. Rochelle.
Thank you. Good to be here.
Good to have you here as well. And I love that we're talking about this topic because obviously on today's show, we're talking about the holidays and, you know, mental illness is still running rampant right now, specifically here locally when it comes to our youth. What is the state of it right now?
Yes, we are in desperate state right now because our kids are really recipients of our inability to manage things. So they passively take on a lot of the difficulties that we're experiencing, and it gets expressed in ways that really they have a lot of difficulty controlling. So our kids have a lot of anxiety, they have a lot of confusion, they have a lot of unanswered questions. The predictable nature of what's going to happen next is uncertain, and all of that creates for them a state of unrest, which for many of them is hopelessness, helplessness, and they're often resorting to ending their lives. So suicidality is high in our adolescent population.
That we're talking about this because obviously I watch a lot of TV, everybody, and I've noticed that a lot of people are saying that, you know, they were at home for almost 2 years doing the virtual school, and now that they're back in school, you know, anxiety is high, social anxiety is high. But luckily, you all in Metropolitan Human Services District, you all have some services that are really youth-centered. Let's talk about some of those resources.
Yeah, so at MHSD, we prioritize the needs by age group. We treat 0 to 65, and we have specialized program from 0 to 5-year-old kids and their parents, and we also have our youth-centric services for kids who are like 7 to 21. And then everything else is adult. We even have geriatric services, but we do the whole gamut of behavioral health services. We do psychiatric evaluations and assessments. We also do substance use evaluations and assessments, and we also do medication management for kids who have to be on medication. But we do the social skills treatment as well. We have group therapy with individual therapy. We have various evidence-based practices, as we call them, that are specific for outcomes that you may be looking for. Like an example of that would be of the first episode psychosis program that's just dedicated to kids who are having their first break in psychotic experiences. That's very troubling and destabilizing, and they need special services wrapped around them. So we have those types of services operating as well for our kids. But we kind of tailor our services based upon what the needs are for our population.
And that's good to know.
Yes, it very much so. And so I know we're going to talk about gambling, but now gambling is something that we also are tailoring some of our services around. On our prevention side, though, we do a lot of work in schools where our prevention team goes in and works on pro-social behavioral changes, because a child cannot change the environment they're in, but they can change how they react to their environment.
Come on, I completely agree.
And so we teach them how to react differently in social circumstances that are problematic.
And I love that y'all are focusing on not only the mental but the social as well, because that piece I feel is so important. And I was surprised preparing for this interview that gambling it's becoming a problem with our youth. You know, we just, of course, you know, government just approved the online sports betting. How is that becoming such a problem when it comes to our youth?
It is absolutely frightening what's happening with online betting and sports betting. The government making it available has really pulled back the veil of gambling that has been happening anyway. But the difference here is with online betting and sports betting, it is you and your phone. It's a very private, personal thing, and there's no way for anybody to really know what you're doing, because what we do on those phones, which is hugely problematic half the time, is something that is very much between you and whomever you're communicating with.
The device.
Yes, the device itself. And so online betting, sports betting, the kids are actually being served, they're predators to lending institutions, so they're able to get money to bet. If parents are involved in it, they're maneuvering around the behaviors of the parents to bet. And we're finding that there are earlier periods of expression of a gambling disorder disorder with the online betting, which may have been delayed because of all of the barriers that are in place with having to be 18 or over to go to a casino and all of that. But now that they're younger, they're getting involved earlier and they're getting hooked on it sooner.
And they're getting broke
And
faster.
they're getting broke. And that, you know what that's doing? That's creating more mental illness. It's compounding the mental illness. So now you got even more depression, more desperateness, more suicidal thinking, and more committed suicide, successfully committed, and more substance use.
And you know, in the time we have left, Doctor, I want to ask you this question. For the parents watching out there who may think that their child has mental illness or they may be involved in this whole online sports betting, what's one tip you can offer the parents out there on how to help their kids and talk to their kids so that they don't fall deeper into the hole that they may be going down?
Yes. Well, the first thing I want to tell the parents is that act with suspicion, that your child is not necessarily going to be the exception to the rule. Your child may very much be right in line with being susceptible. And so ask them the questions. Are you doing this? Follow your own instincts and not assume that you're being accusatory. You're just being inquisitive so that you can help them. And then if they need help, think of Metropolitan Human Services District, and our number is 568-3130, mhsdla.gov. But the purpose for why I'm telling you that is because we have gambling professionals on staff who can counsel you, counsel them, can certainly refer them and get them connected with professional services.
Good to know.
And we're also partnering on the adult side with Bridge House Grace House for inpatient beds. They found that 20% of the people who are in their facility for addiction treatment have a gambling disorder. That if they had not asked, they would have never known.
And that's the moral of the story, everybody. Have the conversation, ask your kids, ask your friends, honestly. Dr. Rochelle, thank you so much for joining us this morning. And like she said, if you all feel like your children or maybe yourself fall into this category, you're seeing all the information on how to contact Metropolitan Human Services District.